Good morning. My name is Dr. Sabrena Noria, and I'm one of the bariatric surgeons here at the Ohio State University Wexner Medical Center.
And my name is Joey Dillon. I am a bariatric patient of Dr. Noria's, but I also work for the medical center on the social media team.
So today we'll be talking about bariatric surgery and Joey's experience with it.
Dr. Noria, I'm kind of curious for our viewers here. What are the types of surgeries that are offered at Ohio State, and how are they different?
So here at Ohio State, we offer two types of surgeries predominantly. One is the gastric bypass, and one is the sleeve gastrectomy. The gastric bypass essentially is where you make a pouch out of the stomach and you reconnect the small bowel. The gastric sleeve, on the other hand, is where you essentially take the stomach, which looks like a football, and make it look like a banana. The differences are that the gastric bypass is a restrictive and a malabsorptive procedure, whereas the gastric sleeve is a restrictive procedure.
So I'm kind of curious, when you're deciding which procedure to get, what are the pros and cons for each one?
Mm-hmm. So when we are taking care of a patient and walking them through or leading them through the process to get to surgery, really we take their medical conditions into consideration, their anatomical conditions, like what does a stomach look like, as well as what the patient wants to get out of the surgery itself. In terms of overall weight loss with the gastric bypass and the gastric sleeve, usually it's about the same out to about 18 months to 2 years. After that, typically patients that have a gastric bypass tend to do a little bit better with sustained weight loss. That being said, people do amazingly with sleeves as well. With respect to resolving the medical problems that are associated with obesity, including diabetes, hypertension, sleep apnea, both surgeries do well, but studies have demonstrated that for the gastric bypass, it occurs faster, especially for patients with diabetes.
And she makes a really good point. So there are obviously, underlying medical conditions people have who, struggle with obesity, myself included. I struggled with GERD, so like acid reflux for the most part. And at Ohio State, in our introductory meeting, they basically said, if you have GERD, you have one option, which is gastric bypass. Are there any other specific, medical conditions that void, for me, I couldn't have the sleeve, but I had gastric bypass. Is there, any specific conditions that, some of our viewers might want to know that disqualify them from one or the other?
Sure. So I would say, generally speaking, there's no such thing as disqualification, right? Because if a patient is not interested in one surgery, even if that's the right surgery for them, we as practitioners, we think, well, let's at least take care of the patient and help them achieve significant weight loss in order to get healthy, and then, focus on other aspects that may have been contraindicated for the surgery. That being said, typically patients with poorly controlled diabetes, we tend to suggest that they have a bypass. Patients like you who had terrible reflux, we tend to suggest bypass. For patients that are better sleeve candidate, those typically are patients that perhaps are transplant candidates and need a lot of stomach left over to absorb those medications. Additionally, patients that perhaps have had a lot of abdominal surgeries and are looking to get a hernia repaired but need to lose weight, we typically recommend a sleeve gastrectomy.
And then, I guess we're going to be talking mostly about gastric bypass today. Even though you kind of explained things, what are the pre-surgery steps that, someone will have to take?
Sure.
I can kind of talk a little bit on my end. I had to go through 6 months of monthly check-ins with my primary care provider. Realizing, not only before and during surgery, but after. And then I think one thing that I really wasn't prepared for was the liver shrink diet 2 weeks before, just to make sure that when you're doing a surgery, there are really no complications with the liver, just because, with obesity, there is a lot of fat around the liver, and everything's done laparoscopically. So you don't want the liver to basically break itself off. So I think that's my biggest, I had to do what for 2 weeks, which is just a lot of vegetables and protein shakes, just making sure that, the liver's nice and healthy for the surgery. So On average, what are those steps
Sure.
that the patient would want to know, one, for the surgery, but two, on maybe on an insurance and what they're looking for?
So that's a great question, and basically you summarized it in a nutshell. But essentially, all patients have both insurance requirements and our program mandated requirements. The insurance requirements, they vary from carrier to carrier, but essentially there is some component of a medically managed weight loss duration, meaning you have to go and see a provider to talk about weight, to talk about calorie restriction, to talk about exercise for a set period of time determined by your carrier, whether it's 3 months, 6 months, 9 months, I believe sometimes can be out to about a year. So that's one aspect of it. Then from a programmatic requirement, which also is in conjunction with the insurance requirements, we do a full head-to-tail medical evaluation, screen patients for sleep apnea, for any cardiac issues, for any liver issues, for reflux, things like that, diabetes as well. And then they all undergo an endoscopy to look at the anatomical fitness of the stomach to make sure that the surgery that you want is the surgery that you can get. Additionally, as Joey said, there's a psychological evaluation that is mandated by the insurance requirements. And additionally, all patients see our dietitian to learn how to use the tool that we are essentially giving them. It's not about dieting, it's about understanding how to eat differently and how to drink differently. So that's sort of all the preoperative workup that patients typically need to go to. And on average, it's about 6 to 9 months to get to surgery, really because of those insurance mandated weight loss requirements.
And you kind of mentioned, a lot of my next question is, Ohio State has a lot of great experts. What all makes up the team of the bariatric program at Ohio State?
Well, we have a fantastic team. It's the Comprehensive Weight Management, Metabolic, and Bariatric Surgery Program. And what that means is that we see patients really holistically. Not all roads lead to surgery in our program, certainly. So we have multiple avenues that patients can take if they're not interested specifically in surgery. But because we have all those avenues, we have all those experts. Starting with our nurses that triage our patients, to our nurse practitioners who manage not only intake evaluations, but also follow up our patients after the immediate postoperative period. We have an endocrinologist, Dr. Ben O'Donnell, who helps especially with those difficult cases in patients that have poorly controlled diabetes. We have psychologists, we have behavioral therapists, and dietitians, and of course the surgeons. So it's a very well-rounded program. But what's great about being here at Ohio State is that we can also reach out to our colleagues in different surgical specialties in order to get their input. For example, cardiac surgery, cardiology, or hepatology, things like that.
And so we briefly mentioned, the pre-work for surgery. What are things that our viewers, potential patients want to know about that post-surgery? Obviously results, but what are things that they need to do? I could talk, ad nauseum about the step diet, but I'm going to leave that to you.
So before I answer that question, what was your experience like?
Like looking back, I didn't find it too challenging on my end. You go through that 9-month process with insurance and going through all these appointments, and then the liver shrink diet, 2 weeks, really not, it's totally all right. It was over the summer, so I was playing a lot of tennis, and so my biggest question was, well, I'm kind of being restrictive with the, calories. What can I eat more technically because of the liver shrink diet? Your big meal is a lean cuisine essentially. So it's like, okay, what can I take to make sure I'm really not going too hard in the negative caloric intake? And then after, there's a steps 1 through 4 diet. The first one is basically just liquids. I think that was probably the hardest, especially in the hospital right after. You're on Liquicell, which is basically just a liquid making sure you get all of your nutrients. That was really rough. But then, eventually, a couple of weeks later, you go into, baby food, and then you're able to kind of progress your way into, I would probably say, a month, month and a half, 2 months of like post-surgery. You're kind of able to fully break into a new normal of a diet. I will say the biggest challenge that I still struggle with a little bit is, that new way of eating and drinking. I was 29 when I had my surgery, and so you're kind of changing, nearly 3 decades of habit. So making sure I'm chewing everything, at least 20 times, making sure that it's fully processed, just because I can personally feel in the pouch that Dr. Noria created that it's not processed enough. Like, I didn't chew it enough. So it's sometimes painful. It's a lot of the time uncomfortable. So I think things like that, and then making sure that I'm drinking enough water. I remember a follow-up we had, I definitely was dehydrated, and she was like, okay, we can give you an IV, but I was so dehydrated, I couldn't get stuff. Right. So really just making sure that you're, intaking not only the correct amounts, but the correct way. I think are those biggest things.
Agreed. And everything that you said, Joey, really is reflects what we try to do in terms of preparing you preoperatively with our courses and our classes and things like that, as well as to reinforce postoperatively. So as you know, we see you 2 weeks after surgery, then we see you, 6 weeks after surgery, and then 6 months, and then yearly after that. And really, our goal is to see patients at every diet change so we can reinforce those principles. And then at about 6 months, it's when we do your lab levels to make sure that your vitamins are okay and all that kind of stuff. And additionally, it helps us also track your weight trajectory, because after 6 months, weight can plateau, and that's the time you want to catch it. Make sure you guys are doing okay. So
yeah, and I will say at Ohio State, you guys are so responsive. Whether it's Kirsten, my CNP, you, another nurse. Usually if I have a question, I always ask in my chart, and I get a really quick response. And I think something that we haven't really talked about in that post-surgery care is vitamins. So obviously when you're having bariatric surgery, you're rerouting things, specifically in the bypass, and your body just doesn't absorb things the way it used to. So, for instance, some of the medication that I was on before surgery was, extended release. I can't take that anymore. And the way, most people process and their bodies break down their food, get their nutrients, mine doesn't do that anymore. So, I have to take specific vitamins every single day, either chewables or multivitamin that you swallow. So can you kind of go into some of the things that maybe patients might not be thinking of, such as, vitamins post-surgery?
Sure. So a couple of good points you brought up there. So first of all, when it comes to gastric bypass specifically, people call it malabsorptive, but really the malabsorption has to do with the vitamins specifically, because when we reroute the intestines, we cannot get nutrients from our food again. That's just the way it is. So that's why we need the vitamins. And people get a little bit nervous about having this litany of vitamins that they have to take, but really, what's your experience been? There are vitamins that are out there that are just a couple a day that will take care of things for you.
Yep.
Additionally, though, the other aspect of the malabsorption related to gastric bypass is dumping, specifically dumping with the gastric bypass, and that really is a response to taking too much sugar in, and your body responding to it. And those symptoms are things like, kind of feeling sweaty, your heart racing, feeling like you may pass out, and unfortunately, dumping. So, patients either vomit or have, terrible bowel movements. And that is because we don't follow the sugar rules. That's the way I like to talk about it. And really, it's a way of patients. It's like a negative feedback, essentially. So we actually recommend, back to our original question, we actually recommend that patients who have a weakness with sugar or their weight is related to sugar intake, we actually do recommend having a gastric bypass, because dumping is very prohibitive to eating more sugar. So those are sort of the complications that can occur, definitely.
And something I didn't mention, obviously, on top of new vitamin intake, I think one thing that I never really thought about when I was going through this process, obviously diet, that's probably why I was getting bariatric surgery, but was the protein intake. And because you're eating so much, fewer amounts of food, essentially, with, your new stomach, there has to be kind of workarounds to make sure you're not only getting, the right amount of liquid, but the right amount of proteins and other nutrients. What are things you would suggest for, maybe someone who has just gone, through surgery and is unsure of how to, tackle that specific problem?
Sure. So with respect to protein intake, you're absolutely right. Protein, 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 always first. Because as you've learned in the program, and as patients learn in the program, a calorie from a protein is different than a calorie from a carb, is different than a calorie from a fat, and the way that our body processes it is different. Proteins keep you fuller longer. Proteins help you heal, all that good stuff. So typically we recommend that if people struggle with the confusion around what they should have, I say keep it simple. Protein shakes are your best friend. Watch the amount of sugar in the shakes, obviously. But they're your best friend, and they're typically about 30 grams a day, at 30 grams a bottle, and we recommend 60 grams a day. So if you bookend your day with a shake in the morning and the evening, you're okay. And then everything else in between, you can, of course, moderate. So protein is one, and then fluid and water, fluids, hydration is the other key.
Yeah, I pretty much always do a morning protein shake to at least make sure I'm getting half of my daily amount of protein. I try to do two, but I know at least I'm getting close to that 60 grams a day with at least one protein shake. I guess I should also ask, when it comes to diet, there are many things you can't really enjoy anymore after surgery that not a lot of people think about. Well, soda's really the big one. Are there any other specific items, food or drink, that people should kind of be aware of, following surgery? Alcohol, soda, things like that?
Yeah, it's a great question, actually. So for alcohol, certainly the way that the body processes alcohol after surgery changes completely. We actually recommend that patients abstain for about 6 to 9 months, or a year, just because the intestines, as we've talked about, have been rerouted, and we just don't know how a patient will react. We also recommend that they do it at home if they're going to have a drink, so that they're safe. Now, alcohol alcohol is just for consuming it, but of course alcohol has a lot of sugar in it. So you also have to be careful about things like dumping if you have a gastric bypass and you drink alcohol. So that's alcohol. The other, what was the?
What are things that I guess patients should be aware of that they can no longer have post-surgery? So
as you mentioned, anything with carbonation in it, it can sort of expand the pouch, and it's very difficult to burp. So after the gastric bypass, so it makes patients very uncomfortable. Additionally, if you expand the pouch, you fill it essentially, and so you're not going to eat that protein that you need to eat. Sodas that are sugary, obviously, that's going to cause dumping. And then lastly, in terms of other food intolerances, and I don't know if you've experienced this, patients just generally will have food intolerances after gastric bypasses. Typically, I hear from my patients, tomato-based things and red meat. These intolerances start early on after surgery and can last about 6 months, but after that, typically resolve. And that that has to do with the surgery, obviously. Not sure why it occurs, but it can be anything. Patients say, I had chicken before, now I can't stand chicken. I don't know if you've experienced any of that.
Yeah, so pork has been like the really big one for me, where even though I chew it quite enough, I process, I break it down, it just doesn't always sit right. It's kind of like pork loin, that type of pork. I can usually do like bacon if it's pretty crispy. But you mentioned carbonation. I haven't really missed soda, but one way I was always getting my water intake were, those sparkling waters you can get at Giant Eagle or another grocery store. And I thought a good workaround was, okay, well, I'll open it and let it flatten, and then I can have it. But I've kind of realized the gas still in that, makes up the bottle that's kind of sitting in there for however long it's been processed, still kind of goes into your body and kind of still creates, you can kind of feel it expanding a little bit. So I think if some people are trying to think of a workaround of flattening, carbonation, it's not going to work. But for me specifically, when it comes to foods that, are troublesome, red meat a little bit. I usually don't eat a lot of red meat. I usually eat ground turkey. But the pork has been kind of the biggest one for me. So I think, obviously, being upfront with the dietitians and your surgeon and making sure that you're listing everything that's going on.
And that's the thing, dietitians are here to advise you. We've heard it all, well, I think we've almost heard it all. And there's definitely workarounds. There's definitely different sources of protein, different types of food you can eat. I will say that, it reminds me that initially after surgery, there's some patients that do experience like a head hunger or mourning or loss of the ability to eat the foods that they loved. And that's a real thing. I would maybe, maybe 10% of my patients mention that when I first see them in the follow-up clinic. And we have support groups for that. That definitely can help patients work through that, because that's a real thing, and that can definitely create obstacles to success. So we take everything that patients say really seriously to try to figure out how to best help them.
Okay. And something we haven't really discussed is, being active, exercise. For me, tennis is my biggest passion, so I play a lot of tennis. I played a lot of tennis even when I was, a person of size. However, I think I can kind of talk on my end. Something I didn't do enough, especially right after surgery, was doing a lot of toning. So can you kind of discuss what you would recommend for a patient exercise-wise, not only after surgery, but before?
Sure.
And how long they should wait, what their restrictions should be, stuff like that.
So that's very patient dependent, depending on if they're coming to surgery to lose weight for a hip replacement or a knee replacement. But just assuming, the average patient, what we would recommend that if they can, to do just basic cardio exercises before, or any sort of exercises they enjoy doing. And I think that's the key, right? You have to enjoy doing it. If you don't like going to the gym, don't go to the gym. If you like to play tennis, that's what you need to do, but just do it. That's the first thing. Now, after surgery, we recommend that patients are we actually, you remember, we walked you the day of surgery to get up and start walking around.
Yeah.
And certainly for the first 2 weeks of your recovery, we do want you to get up, walk around, take the stairs, do all that good stuff. And then once you're seen in clinic, then we start introducing the cardio piece of the exercise, where on average we say patients should be exercising about half an hour a day, 5 days a week. And then about a month later is when we add the weight training, the strength training. Why we do that is really because there is evidence to show that when you train and you build muscle mass, that increases your metabolic rate to sustain long-term weight loss. And that is really what we need to do over the long term. The short term, patients will lose weight no matter what they do, because that's the surgery. But then after 6 months, you have to start thinking, if I want to continue to lose weight, we have to exercise. And isn't it better to have, sort of establish those habits prior to that 6 month sort of cutoff? So, so that's how we sort of, that's the algorithm, I guess, that we give patients essentially. Now, how to exercise? Certainly there are a lot of programs that are out there, certainly gyms, whatever patients want to do, but I would say that we have recently partnered with a great program here actually at OSU. It's called Exercise is Medicine, to help patients understand how to train, essentially. I mean, people can do treadmills, but lifting weights, things like that, you need a professional to train you. And so that's something that we've just established in terms of a pathway. So really excited to develop that program as well.
And I'll kind of talk a little bit about, my personal journey at Ohio State.
Yes.
So I started the process in January of 2020, so right before COVID. So obviously the whole process was a little bit different because elective surgeries really weren't, allowed until pretty much right before I had it that October. Since then, I've lost probably about 210 pounds. And I think the biggest thing for me has been, again, tennis being my biggest passion. So I've really been throwing all of my being into seeing how far I can take my tennis. And I think the biggest and proudest accomplishment I've had has been playing a professional tennis tournament. It was always my dream growing up. And obviously, luck has to kind of fall in your favor to be able to get into the tournament. That did. I had a complication with my surgery. I had an ulcer that perforated, so I was actually back in the hospital. And the tournament, it was at Ohio State actually, a minor league event, and I was in my hospital bed and I signed up, and I was like, it's in a month, we'll see what happens. And I got in and, I got crushed, obviously, but it's
doesn't
being
matter.
able to, last on the court, hang in these rallies with, professional caliber players. And I don't know for a fact, but I'm pretty sure I'm the only, professional tennis player who has had bariatric surgery. But, having the surgery has had an incredible impact, not only on me physically, but mentally. I've never been happier. I tell so many people that I was definitely, insecure in myself, and I would always, mask, by trying to be funny and just blaming it. Oh, I don't want to do so and so because I have school or I have class or I have work. But it's really just because I was insecure with myself, and I'm a lot more confident now, and I'm able to, put myself out there, make new friends, make new relationships, travel and play a lot of tennis. Really try and maximize, this. I call it a new lease on life, and that's really what the surgery is.
And that's the point. So we as physicians, we want your medical problems to go away. That's the first thing. We want you to lose about 50% of your excess body weight. But then patients ask me, well, Dr. Noria, how much should I lose? After that, it's what you want to achieve in life. That's all it is. And you're achieving it, which is fantastic. Just fantastic.
I think kind of just to wrap things up, what makes Ohio State, so successful, not only locally but nationally as a bariatric program, and why should a patient choose Ohio State?
So, why we're so successful? One, we have a very comprehensive program. It is one of the first in the state, and I think what I love about being a surgeon in this program is that we're always looking to improve. We're always looking to be better. And through our research, through our interactions with patients, I think that is what sets programs apart. And the longevity, the reputation, the number of patients that we've done, all that experience, I think really makes this one of the best programs in the country as far as I'm concerned.
Awesome. Well, not only thank you for joining us today, but for basically changing my life for the better. It's night and day of where I was, just under 2 years ago to where I'm at now. I can't say enough good things about the program at Ohio State. That you guys care, and I'm not just saying that just to say it. Being able to, have the responses so quickly and have, the support from all of the staff, not just you, but all the nurses and admins and things like that. And even going back to the complication I had, being able to, I was, in the ER, had a scan done, and you were right there, being able to basically assist in that process of surgery. So, I can't say enough thanks, and I can't say enough praise about the bariatric program at Ohio State. If you have any specific questions, please leave them in the comments. If you want to reach out to Dr. Noria or anyone else on the bariatric team, we'll make sure to leave a link to the website in the description. Thank you.
Thank you.